Sudden unexplained infant death syndrome is the leading cause of death in babies from 1 month to a year old. Most happen in the first 4 months. Some suggest a very simple practice could help. Tina Martin explains.
There we go.
Could a cardboard box with a mattress really be a key to safe sleep for babies? To mom Stephanie Goldberg, it looks pretty basic.
I mean, it seems very rudimentary and a little archaic, but sometimes the simplest things work the best, and as long as it's safe, I think it's great.
The idea originated about 50 years ago in Finland and was associated with a decrease in sudden unexplained infant death.
That's a really interesting and compelling story.
Dr. Greg Hagan, chief of pediatrics at the Cambridge Health Alliance, says it will take more than a compelling story to convince him and others in the medical community that these boxes prevent sudden unexplained infant death.
So there may well have been other things about that experience during that period in Finland that could have contributed to that decrease in sudden unexplained infant death. So there is an association between the introduction of the baby boxes and an improvement in that measure, but it's not at all clear that they're related causally.
Meaning there is no data to prove anything. But for other healthcare workers, it's still an idea worth trying.
Even without the evidence, I'm a firm believer in offering people different alternatives to help them meet their needs.
Donna Sherrill has been handing out boxes since July of 2017 at Winchester Hospital. Since July, Sherrill has given away 200 baby boxes paid for by an in-kind donor at the hospital.
I knew that we wanted to give our parents something more, not to replace their sleep environment that they already have, but something that might help when, for instance, a baby's taken into bed because maybe it's the only room in the house that's air conditioned. Parents wake up, they've rolled over on the baby.
Did you talk to them earlier today?
State Senator Patrick O'Connor wants to know more, so he sponsored a bill for a baby box pilot program. If the bill passes, the state would hand out boxes filled with formula and diapers that would be distributed through hospitals, community centers, and nonprofits.
We introduced a bill that is going to allow for safe sleeping environments for every child born in the Commonwealth of Massachusetts by providing baby boxes for expecting mothers, expecting parents, expecting guardians. We're saying if we can do something that could lead to that rate going down, shouldn't we do it?
Stephanie Goldberg shares that same sentiment.
If it's helping new moms, then I'm all for that.
Tina Martin joins me now. Hi, Tina. Obviously, it's the box.
That's
and as
the
people
box.
can see, mattress, diapers, correct?
Correct.
Okay. So what's the state's infant mortality rate and as compared to other places?
So the state of Massachusetts is 4.4 per every 1,000 births. The national average is 5.8 per 1,000.
So we're already doing better. What's the status of this legislative effort, this O'Connor guy?
So he has a bill, so does Diana DeZoglio from Methuen. She's a state representative. They're both pushing the bills, two separate bills, one through DCF, the other one through the Department of Public Health. And they both are on their way to the Ways and Means after being received favorably.
Any other hospitals and any other states that are doing this beyond ours?
Yes. So Winchester Hospital is doing it, Cape Cod Hospital, Falmouth Hospital. And then Alabama and New Jersey also have baby box programs that are state-run.
Do you have any data on
No.
nothing yet?
No.
So we should end there being clear so we don't give false hope to people. Some think it's a great idea, but it is clearly an unproven advance as of the moment,
Absolutely.
correct?